A damning inquiry has exposed the traumatizing use of seclusion and restraint in New South Wales mental health units and emergency department safe rooms, describing entrenched discrimination, stigma and prison-like punishment many patients are subject to. The independent review into restrictive practices in New South Wales mental health settings was released on Monday after months of public forums, submissions and inspections of psychiatric units and EDS. Patients and their families described services that traumatize and show a lack of compassion and humanity, including a culture that promoted strip searching and other punitive methods, according to the report. The review, led by New South Wales Chief Psychiatrist Drive Murray Wright, detailed instances of patients being trapped, claustrophobic and agitated in seclusion rooms built like prisons with no access to bathrooms or fresh air. Many patients reported feeling dehumanized and stripped of their sense of autonomy, agency, dignity and human rights, the report read. Some consumers and carers reported that seclusion and restraint were used as a threat or a punishment, as a means of enforcing compliance and obedience. The exhaustive and harrowing report was dedicated to Miriam Murdoch, whose disturbing treatment in seclusion captured on CCTV footage while she was a patient at Lismore Base Hospital sparked outrage and provided the catalyst for the report. The footage showed Ms. Murdoch disoriented, naked and covered in feces in the hours before she died of traumatic hypoxic brain injury on June 3, 2014, caused by numerous falls and beating her head against hard surfaces in a seclusion room. There were close to 3,700 episodes of seclusion and restraint in New South Wales in 2016-17. Roughly 2,200 people were secluded for an average of 5.5 hours. These figures do not include those who were secluded in a hospital emergency department. The Wright review detailed the traumatic overuse of the so-called safe rooms in EDS and a culture that was overtly stigmatizing and discriminatory towards mental health consumers and, in some instances, towards mental health staff as well. The review found this discriminatory and stigmatizing behavior at all levels of the workforce, and staff with insufficient skills and basic mental health knowledge working with patients. Reviewers found no convincing examples of collaborative leadership in mental health units, and described confusing policies, inconsistent approaches to patient safety, no reliable monitoring system of seclusion and restraint in emergency departments. There was no routine on-site after-hours supervision in several mental health units, inconsistent individualized care planning and access to data on seclusion and restraint, according to the report that revealed underlying factors that had implications beyond the mental health system. State Health Minister Brad Hazzard and Mental Health Minister Tanya Davies announced the government would implement all 19 of the report's recommendations, including minimum training standards for staff and improving transparency in seclusion and restraint reporting. The government would also immediately invest $20 million to help hospital managers improve their therapeutic environments, and launch a further review of EdSafe rooms.